unconventional and impactful career path. His webinar, workshops, and training programs are highly sought after by young professionals across India. Today, he's here to share valuable insights, practical advice, and real world strategies on how to navigate your dental career, whether it's clinical, non clinical, entrepreneurial, or beyond. Let's give a big virtual round of applause and welcome Dr. Naval Ghule.
Hello, Sakshi. Am I audible to you?
Yes, yes, sir.
Yeah, great. Thank you for having me over here. We have almost 48 people with us, so I think we can begin.
Yes.
So, just another introduction of me. I am Dr. Naval. I have been practicing for around 9.5 years now, and more inclined towards the clinical aspect of dentistry and the public aspect of dentistry. Also, inclined towards teaching uh, dental students and graduates on how to navigate through this world of dentistry. So yeah,
All right. So we have bunch of questions for you, sir, today, and we'll answer
I
them one.
I, I saw those questions on the group.
All right.
Yeah, yeah.
So first is doing MDS essential to earn well, or can general practice be enough? If someone doesn't get good MDS seat, what alternative like DNB private practice can help?
Most of here over, I think, have given the MDS 2025 exam or thinking about giving NEET MDS 2026 exam. We all have this question whether I should do MDS or not, which branch to choose, whether it will really help me or not.
Sure.
Mm,
All
This is
right.
my personal opinion that
Okay.
if you self and not to, gain a degree or with this degree I'll get a job or all those things, do it for yourself because you like uh, being a specialist. You like things to be precise. For example, a difference between BDS and MDS is an MDS would be precise in his root canal, an MDS would be precise in his periodontic work, and an MDS would be precise in his RPD or FPD, etc.
Yeah.
So if you like precision, then MDS is meant for you. Of course, having a higher degree over your bachelor's degree is always good. There is no doubt.
All
The
right.
number one thing that you decide is on is time, whether you can dedicate 3 years of your life, the responsibilities that you have over your head, whether you can dedicate those 3 years without, going back financially or uh, shedding off responsibilities that you have. So if you can dedicate 3 years of your life and can spend that much amount of money, then definitely yes, you should go for MDS. It is always beneficial. It will help you earn a lot of money when it comes to private practice
Yes.
because of your skills, of course. But said that, BDS and MDS, when they pass out, in terms of running a private dental practice, in terms of the business aspect, both of them are at the same level. He
Yeah.
or she might be a little bit confident in root canals, but he or she wouldn't be confident in dentures. He or she wouldn't be confident in extractions. He or she would be confident in ortho cases, but he or she wouldn't be confident in general dentistry. So one of those aspects gets solved try to set up your own practice. But other than that, both are at the same level. Patient exposure is a thing. With MDS, you learn to talk to patients. In BDS, it depends on your college of as to how many patients you have interacted with. But definitely having an MDS degree will help you if you can dedicate 3 years of your life and that much amount of money. If not, then don't do it. Trust me, you will land up in the same place as you were when you had passed out your BDS. There are many options other graduates can do in clinical.
Yeah.
My
Yes.
voice
Very.
is not audible. Dr. Gagan
Yes.
Agrawal has mentioned that my voice is not audible.
No, sir. Your voice is audible.
Okay, I think Dr. Gagan, you need to check your bandwidth then, because Sakshi is saying that it's audible.
Yeah, sir, it is okay now.
Okay. Yeah, sure. If anyone has any issue, you can just mention on the group chat and we'll answer it accordingly. So first is time, second is money, and third is you should really like your field. You shouldn't start hating it because you have to practice it all your life. So
Yeah.
you're filling your form in June and July. Your first round, your second rounds will happen. Take that decision carefully. If you really want to practice dentistry and set up a private clinic, become a businessman, and develop entrepreneurial skills, opening a private practice on BDS level is also good. So
Yeah.
both are good.
Okay.
Nothing
Okay.
is good and
So,
bad.
well,
It is just whether the time and money you can put it on or not.
thank you for elaborating this because I think this is the most asked question. So we'll move to the next one is I would like to know comparison between fellowship and MDS after BDS.
If you are in, if you want to go into academics, then MDS is necessary. If you don't want to get into academics, both will work for you and your clinic. If you do a fellowship in endodontics, you'll do good implants in your clinic. If you do MDS in endodontics, you'll do good root canals in your clinic. But other than that, if your aim is to go into academics and research, an MDS degree is always beneficial over any kind of fellowship. Or you are a person, you don't want to learn everything of root canal, but you know the basic bread and butter of root canal. You can perform access opening, BMP, do obturation, and etc., but you want to learn micro dentistry,
Yeah.
that specific area or a specific topic you want to learn and master that, then fellowships are good. If you're not interested in the research aspect of MDS, if you're not interested in the academic aspect of MDS, you can go for fellowship degrees such as microendodontics, such as biomimetic dentistry. You can go for government affiliated fellowship programs. You can go for private affiliated fellowship program. It doesn't matter if you're going to practice in your clinic. The only degree that matters is your BDS and MDS registered in the Dental Council of India. Other than that, any degree, any other fellowship, which is not, yeah. So any other
Okay.
degree other than your BDS or MDS degree will hold no value academically.
Yes.
It will hold value for your clinic where you want to practice. But you can take this decision later on also. As in, once you set up your private practice, you get to know that, okay, out of 10 patients, one is inquiring for an implant lodge, one is inquiring for an implant. The other is inquiring for smile designing or certain cosmetic procedures or composite procedures. So based on your OPD, you decide as to what higher education you want to pursue now, whether a short course or a fellowship program, etc., so that you need not call consultants for that. And
Okay.
the part that you pay to the consultants gets saved and is added into your profit. So if your aim is to run your private dental practice, do fellowship because you will practice them in your clinic and it will help, that particular fellowship will help that particular treatment to be done well with precision in your clinic. If your aim is not that, if your aim is just getting degrees and increasing your CV and going academically, go for MDS instead of fellowships.
All right. So which fellowship you will recommend in today's day?
Based on your interest, I feel implantology is a very booming industry
Yeah.
and it doesn't require any likeness for that. Of course, you should like a little bit surgery and a little bit prosthetics and prosto for that.
But other than that, it is not a field to hate. It has a lot of money. There are various advances in implantology also that you can grow in. So it is a field of growth. So according to me, implantology is a good fellowship program. I would not recommend any Botox or fillers or hair transplant fellowships, etc. Not
Okay.
to be done by a BDS graduate, ideally. But
Yeah.
you live in India, so you all can decide for yourself. But it is my personal opinion. Smile designing, playing with veneers and zirconia crowns and gum surgeries and gum aesthetics and etc. is also a good field.
Yes.
There we talk about cosmetics, so fellowship in cosmetology, specifically in veneers and related to gums and all those things, improving your smile and etc. There, I think is a good learning opportunity and growth. But other than that, I totally vouch for implantology.
Okay. So we'll move to the next question. That is, what is the scope after MDS in oral pathology or oral medicine and radiology in India?
See, I think Sakshi, you meant to say MDS in non-clinical branch, right?
Yes.
See, I have a lot of good friends who are MDS in oral pathology and MDS in oral medicine and radiology in India, who are very successful and are earning good amount of money. Everyone has chosen a different path.
Yeah.
Uh, Private practice, practicing this kind of field in your private dental clinic is difficult. If your aim is to open up your own private practice, you would need to learn general dentistry, even if you do an MDS in oral pathology or OMDR. So, if your aim is to run a clinic, I would not suggest this to be your first option. But if you like
Yeah.
academics, if you like research, if you like, cancer cells and all those cells and biotechnology and those ये receptor वो receptor पे कैसे act करता है and all those things,
Yeah.
there is a lot of scope. One of my friend, Dr. Prachi Mathe, is in Tata Cancer Hospital in Mumbai, Pune, and she is working on a project over there related to oral pathology, and she is an MDS in OMDR from GDC Mumbai,
Okay.
Government Dental College and Hospital in Mumbai. So
I
she
think
is working over there. Yeah.
I think scope for oral pathology in abroad is like high, more
Yeah,
than it.
because it is more research related and academic related and theoretical related.
Yeah.
So of course, because in out of India, to practice dentistry is too difficult. You need to clear a lot of exams. So
Sure.
those who go with this degree, they get into biostatistician or MPH or MBA, research related as a research scientist and etc. They get into pharmaceutical companies. They get into insurance companies wherein a lot of research is required related to medicine. So not just dentistry, you will be involved in other work related to medicine and research as well. It has a good scope if you like reading and if you like writing a lot.
Yeah.
I don't personally like that. So it is a good field. Yeah.
All right. So the next question is, what should we take care of when opening a clinic setup, and what is necessary thing one should learn before opening a clinic? Guidance about how to open and run a dental clinic, finance management, and etc.
Opening a dental clinic is like opening a business.
Very
So
true.
you should have certain knowledge of business administration, managing a business, running it. All those managerial aspects should be learned. But once you open up a dental practice, some people learn it over the period of time. Some
Yeah.
people do an MBA for that, a business MBA and all those things. Chains of clinics, and then some have idea or open up a dental lab or any other material company, etc. But your dental practice, unfortunately, our colleges or our dental curriculum doesn't teach us the financial aspect and managerial aspect of running a dental practice. It teaches everything other than this. And most of the dentists end up opening their own private practice and they learn over the period of time about the managerial and financial management practice. You can definitely join a program wherein they teach you general dentistry, wherein they teach you the business administration part and the financial aspect, so that you don't make those mistakes that they had made, which will eventually help you run your practice successfully early on. Your practice would be successful. It is not that if you don't enroll in such programs, you will have a failed practice. It is not so. Dentistry is a beautiful field for young for opening a private practice. Everyone is earning. No dentist staying in that area for 10 days running a clinic says that, I am at loss. If he is at loss or she is at loss, maybe something of the managerial and financial aspect he or she didn't do good. But other than that, running a private dental practice, you get success. Trust me, it is the best option that you can do if you are of business acumen and want to learn all those things. Of course, you can join a program wherein they teach you those business and finance skills. Other than that, to open up a private practice, your general dentistry should be perfect. You
Yes.
cannot not know of how to do a OPD, how to diagnose, how to interpret and come to a final diagnosis by looking at an X-ray or investigations, how to start the treatment. The general dentistry, that is the bread and butter, your root canal, your extractions, your FPD work, RPD, okay, oral surgery, okay. I understand that, one cannot do that
Ye-
completely, but your root canals, 70-80% of your root canals, 70-80% of your extractions, 70-80% of your prosthetic work, you should be able to do. Only when you know these kinds of things, only then open up your practice. Otherwise, your name will be bad. Naya clinic hai, it is a new clinic, the doctor doesn't know anything. This is
Exactly.
the harshest criticism that you will get if you just open a dental practice. Of course, you learn over the period of time also. If you don't know these general procedures, also for those who don't want to learn the general procedures, your clinic will teach you either in a good way or bad way. But if you have
So,
with
according
you,
to you,
yeah.
so as per you, like when one must open their dental clinic, like after completing the internship, like how much must be the gap, or like they must start the clinic immediately?
If he or she can perform a access opening, BMP, obturation, POR, and a prosthetics, and a prosthesis, at least a 2 unit, 3 unit bridge or a single cap on anterior premolar and molar, and can extract root pieces, painless extraction of root pieces, not all grossly decayed teeth, but all of mandibular grossly decayed teeth. I understand that maxillary is a bit difficult, and can talk to the patient efficiently, has a good demeanor as a doctor, thinks about the patient, go for it. Some people learn it in their college itself, who have a good OPD flow, or out of 100 only 10 want to work. ऐसे भी colleges होते हैं.
Yeah.
बाकी के 90 लोग सिर्फ attendance के लिए जाते हैं. But your aim is to do maximum patients. Once you get, once you learn these general skills, you are ready for opening up your own dental practice. Other things you'll learn over the period of time.
So, like when did you open your practice? Like,
I started immediately, passed out in 2015 in June, and I opened up my practice in August, like in a month.
okay,
It was a very, I opened my first practice in Dadar. Now we have 4 clinics, uh, Kurigaon West, Kurigaon East, Malad East, etc.
yeah,
Managed by us only.
okay. So,
So
how was your
I
experience
started immediately
initially?
because I knew root canals and extractions.
Yeah,
And as I had given an earlier example, I was that prime example कि 100 में से 10 लोगों को पेशेंट्स करने थे. हम मेरा वो टाइम था स्पेसिफिकली,
okay.
एंड वो 10 लोगों में से मैं एक था, फॉर्चुनेटली. एंड जो भी डिपार्टमेंट में जाता था, चाहे वो पब्लिक हेल्थ हो या एंडो का डिपार्टमेंट हो, I used to make sure that I do patients and more so ever talk to more and more patients. Even if those are not my patients, I used to go and solve their problem related to some other doctor. Because I knew कि पास आउट होने के बाद कोई ऑप्शन नहीं है, प्रैक्टिस में जाना ही है.
Yeah.
I was very determined to open up my own practice. That's for sure. From third year, when I got to know what clinics are and when I got to know how much dentists are earning on BDS degree. So that was my realization in third year that okay, final year would be like to gain knowledge and give exams. Internship should be, to try and gain those maximum skills. Someone has messaged that my voice is constantly cutting.
Not constantly, but yeah, in between.
Okay. I
Maybe
think
some
my
issues.
bandwidth is low. It's a lazy Sunday afternoon, We have our camps going on right now in Thane and pre treatment camps going on
Okay.
there and I'm at my house. So I think because of the bandwidth, my voice is cutting.
Sir,
But
one more request.
please,
Can you please stop these admitting the peoples that they are living in between us and they are joining? They are more disturbing. That some notifications are continuously coming. This person is left. This person is has joined. So as you are admin, please either you admit all them at once or you will stop that.
we have made it open that anyone can join with the link.
And we cannot off the
I request.
notifications.
Yeah. We cannot off the notification. It will come.
Okay, no
And
issues.
also
Yeah.
Thank you.
Yeah.
and also we'll have a very different webinar, especially on like how to open a dental clinic, like very detailed one, and it will be coming after few months.
So Sakshi has decided the list of webinars that she is going to conduct. Yeah.
Yeah. So yeah, moving forward to the next question. Scope of dentistry in India and abroad. How can I study in abroad and what are the benefits? Is UK a good place for dentist?
I don't know about UK, but Canada is a good place. Australia is a good place, and USA is a good place. There is a lot of racism in UK, and because of that, I would not. There is racism everywhere. So इंडिया में हो तब तक रिस्पेक्टेड हो, बाहर जाओगे तो वो रिस्पेक्ट गेन करना पड़ता है.
And also they don't allow directly like opening up a clinic. You always have to work
Directly
with a
by giving. Now, if there are countries and specific states in USA that allow you to open up your own practice as well after
okay.
certain years, because that is the rule of their dental council. Some countries you require to give exams and directly can practice. Some countries you require to give exams, get into a dental college maybe in third year, complete their DDS or DMD program. Over there, why most of them do not prefer to open up their own practices? Because there is a lot of investment. At least
Yeah.
3 to 5 crore Indian rupees is their investment. That is the reason those people who have already done DDS or DMD are not opening up their own practice, because there is a lot of money in being an associate dentist as well.
Okay.
So going abroad is a good option if you have everything planned. Just don't go over there and plan everything. Plan prior, go through a consultancy firm, talk to people who are already doing those courses and see whether you can do it or not, because life over there is very lonely
Yeah.
compared to the Indian life that we live. It is
Also
very, very lonely. So it will be you and your partner and no one else. So this is my personal experience that I have heard and seen my friends and other juniors and seniors go through. But some people need practice abroad. So if you are one of those persons
Bunny
and
cat.
have everything planned, I can mute this person. I think she has muted. No.
Yeah.
Yeah. Okay.
All right. So, moving to the next question, is working in hospital a good choice just after I finish my BDS? And are the courses useful like cosmetic dentistry?
Yes, working in a good running hospital with a good OPD, dental OPD, if they have, is a good option. Private hospitals, they hire you early on. That is, even if you're a fresher, but they'll pay you less. Uh, UPSC, MPSC exams to become a dental officer in government or municipal corporation run hospitals. So you need to crack those exams, and then you become a dentist in those municipal or government hospitals. And private hospitals, they hire you. There are diagnostic centers as well, private diagnostic centers, chain of diagnostic centers who have a dental clinic, not a hospital, but a diagnostic center who have dental clinics in them. You can search for them. They hire early on. The more fresher you are, the less salary will be yours. The more experienced you are, the more you can bargain. They will still provide you less, but you have a choice to bargain. So yes, working in a hospital is a good choice if you get that particular good hospital wherein they'll pay you well for your time and uh, of course should have patients. And cosmetic dentistry, as I said, veneers are a good option. Smile designing are a good option.
Yes.
Implantology, if you want to use in cosmetic dentistry, is a good option, but I would not recommend Botox, fillers, and other facial aesthetics that they call these days. Even if at BDS level, also, I think that we shouldn't get into those things. If then do an MDS in oral and maxillofacial surgery and do all those things. But one shouldn't do that. Instead, develop an acumen implantology or microdentistry. There are a lot of good non-legal, I mean, legal fellowship options available in. But if you want to go in the route of practicing Botox and hair transplant, etc., someday or the other, some kind of legal action will be taken against you, and you don't want that. You want to set up your private practice at a particular place for a longer period of time, lifelong, of course. So don't go into that. But veneers and prosthetics and all those cosmetic procedures, cosmetic dentistry is absolutely fabulous.
Also, like, can you just speak upon the junior residency, which
Interview
takes place in
for mayorship,
yeah.
government and municipal corporation run hospitals. They take direct interviews. Some
Okay.
hospitals, they don't take interview. They take those dental officers or junior residents through UPSC and MPSC. MPSC is for Maharashtra and other state level exams. So this is the only two way that you will become a junior resident in a government or municipal run hospitals, state run or central run hospitals. In private interviews of
All
these
right.
government hospitals, you need to have that CVN experience, an institutional experience of at least 1 year uh, in a government institution. So those who have passed out BDS and MDS from GDC Mumbai
Yeah.
and other government dental colleges, they are given priority. In those also, those who belong from a caste, that is NT, ST, etc., OBC, they are given priority hierarchy wise, and in them also those who have good percentage in their final and MDS marks are priority sheet, wherein those passed out from private dental colleges and associate colleges have zero, no 1 to 0% likely chance to get into a government hospital directly via an interview. Gone are those days wherein you have pehchan in that hospital of an politician and etc. Because now the RTI, that is Right to Information Act, is a bit tough to crack. And if you have that kind of connection, go for it, use it. But it won't work as it was working 10 years back. So the admission procedures are now quite strict for junior residencies. Yeah.
Okay. So moving forward to the next question is, How to get a government job after BDS and how to apply for it.
Dental officer post, UPSC, MPSC. Select dental officer post, otherwise you will get something else. And crack those exams and get government job without any hassle, without pleading to someone that मुझे ले लो, मेरा interview अच्छा गया कि नहीं गया, etc. So if you want to go in a straight way, then you have to exams of dental officers. And then if you want to go through interview, as we discussed, it is based on your CV, where you have passed out from, which experience you have. The private practice experience doesn't count in government job. Okay, you should have a government institutional experience of a hospital. Private hospital experience is also valid, but not that much. But a hospital experience when you apply for any government job, no one hires freshers in that, and at least 6 months, rarely, and mostly 1 year, and then any other government job. But if you want to practice dentistry, then a dental officer is the post. But other than that, yes, food safety officer
Hmm.
and medical officer and public health officers are the other posts that wherein you get government jobs. Most of them are ad hoc or locum based, that is for 3 months or 1 year. After that, they won't renew your contract until and unless it was written over there that will renew your contract. But mostly these ad hoc and locum posts, they don't take you again after your 3 months or 1 year is over.
Okay.
So yeah, there are other posts other than dental officer where BDS graduates are eligible. But then your work X matters as to what you have done in those. Like Dr. Sakshi is working with an NGO right now and is a member of it. So she might have a better chance at getting an MPH, public health officer post, an associate public health officer post in a tier 2, tier 3, or tier 1 city in a government run, but it won't be wherein you will practice dentistry. Health related schemes and programs such as polio or tobacco or etc. Yes, it is unfortunately challenging.
Yeah.
Yes, it is challenging for open students as well. A lot of challenges over there. But then दूसरों के ऊपर क्यों ही इतना rely करना है? I personally motivate everyone to open up their own private practice. Just
Yes.
open with a business acumen, that's it. Then dentists are earning a lot of money. No one is telling you because उनका competition बढ़ जाएगा ना. So skills पे ध्यान दो. Work on your skills. You don't need. I will tell you, even if someone now offers me a job of like 50,000-60,000, I would reject it because now 50,000 would suffice for my life. I am telling you. So if your job is like 1, 3, 4 lakh rupees ka job, then it's totally fine. Don't get into now. If not, then now 50,000 is a big amount for you. But when you get to the age of 28, 29, 30, 31, 32, 33, 50,000 won't suffice for you. So government jobs अच्छे तो लगते हैं, but as a dentist, it will not suit your lifestyle or upgrade your lifestyle.
Yeah.
The private practice will help you get to that stage. So if you're not smart enough or you cannot crack those exams, private practice is always a good option. I have friends, juniors and seniors who weren't that smart in college. Baseline marks, just passed. 2 to 3 backs. But once they started their own practice, they are now very, very successful. I would advise that you should know root canals, extractions, 80% root canals, 80% extraction, and 80% FPD work. If you know that, you can open up your own clinics.
I think the biggest example is Sir itself.
Yeah, I knew those things. That is why I was confident enough, and I was sure that I want to go and get into dental practice. Over the period
Also,
of
for
years, I have
government jobs,
realized
it's
that I
more
am not a
about
person who can. Yeah. Sakshi, you were saying something?
Yeah, in government jobs, I think it is more about vacancy. And in Maharashtra, it's the vacancy, the news, and the job updates, they come very less.
Yeah, they're rare. Very rare.
It's more in UP, Bihar side.
Yeah. Yes. And someone had asked a question wherein how can we get associated with an NGO or stuff like that? You can always volunteer. You can always take the initiative. Options are always open. But in that also you'll have to work hard to get a job, a public health job. Exams are always there.
Yeah.
You need to study for that. There is no job wherein there is no interview or there is no exam for that.
All right, we'll move to the next question.
Yeah.
That is, okay, so how to start non-clinical career without any additional course, and what are different non-clinical options?
So on your
Second
BDS
most
degree,
asked
you
question,
can
sir.
get into a non. Second most asked question. Okay.
Yeah.
So your BDS degree, you are a doctor. Non-clinical companies need a doctor, especially dentists, because they are not, inclined towards opening a hospital like an MBBS or an MD. The first preference given by non-clinical companies are dentists and not MBBS, because MBBS people generally don't apply to these posts. Dentists do. It is a very, you know, good field to venture into, but only on BDS degree you wouldn't have growth. Like after 3 years practicing or working in the same company, you won't have growth in terms of your salary just on BDS degree.
Yeah.
First is your position will be less, your salary will be less with a range of like 25 to 35,000 per month in hand would be your non-clinical salary on as a fresher and with BDS degree. But if you do a postgraduate, a PGDM course or an MBA, MPH or a short non-clinical course, you get higher pay and higher position even if you're a fresher.
Okay.
And your growth is comparatively faster compared to a BDS who is working in that non-clinical company since like 3 4 years. Your growth will be faster. You can switch companies better. Your application gets selected better. So if you really want to go into non-clinical and can dedicate 1 2 or 3 years, there are different courses. 1 year का भी course रहता है. So there is a 1 year on 6 months online and 3 6 months offline course in emergency services. That is that ambulance and medical emergency and management of that, wherein you get in hospital with a starting package of 6 LPA, good package and good growth as well. So there are short good courses and there are long good courses. Don't go with all those online MBA and healthcare
Yeah,
management courses.
very
They are
true.
all scam. I am telling you, करने के लिए कर लोगे ऑनलाइन एमबीए बट बाहर के कंपनीज में कुछ वैलिडिटी नहीं है. आई कैन स्पीक विथ utmost confidence because my wife is at a higher post, Dr. Ritika Tiwari. She is in non-clinical completely. She has done her MHA from Tata Institute of Social Science. That is the most prestigious institute in India, where
Yeah.
you get the hospital administration from. It is like doing VDS or MDS from AIMS. So if you don't want to do MHA, you should do it from Tata Institute of Social Science. So with that kind of background experience, I am speaking to you that don't go ahead with these online MBA and MPH courses of different colleges that you see ads on Instagram. If you want, go with a PGDM, go with an MHA MBA from a reputed institute. The list we can send it to you. You can always get in touch with us. Always
Yes.
ask questions. We'll send a list of colleges. The only thing you have to do, you have to see is whether they are giving placements or not. वरना वो करने के बाद भी जॉब ढूंढना पड़ेगा. And getting job in non-clinical is also tough. It is not easy
Exactly.
even if you have an MBA or MPH degree with you. So therein also a lot of people are applying for those posts. So if there is a good college which provides you direct placement, the start of your non-clinical journey is smooth. but it is a very, very good field for those who don't like clinical dentistry. People do सुबह को 9 to 5 नॉन क्लिनिकल करते हैं, 5 to 9 क्लिनिक चलाते हैं. Some people do both also, but वो ज्यादा साल तक चलेगा नहीं, but they do it for money. That also you can do. Once you learn swimming, you won't forget swimming, right, in a pool. So it is like that only. Once you learn dentistry, you won't forget it. You might take some time to get back into it, but you can switch anytime from non-clinical to clinical. But you cannot, now at the age of 30, now I cannot do non-clinical because I cannot survive that first year in non-clinical because it is very toxic. It is very, mind draining job of non-clinical. So those who survive the first year in non-clinical in that company, then उनका growth अच्छा होता है. तो non-clinical is for you. First year survive करने का energy नहीं है, तो at the age of 28-30 don't expect कि तुम non-clinical में career बना पाओगे other than and PGDM or any long courses that you will do from which you will get direct placements. You won't get jobs in non-clinical once you are 30. So जाना है तो अभी एट द एज ऑफ 24-25 जाना है ताकि आप जब 30 के हो जाओ तो आपको 1-2 लाख रुपए सैलरी रखे. इज इंडियन BDS degree valid? What was the question?
Just a minute.
Is Indian degree valid in USA or we have to apply there? You need Dr. Ria, you need a proper consultant because no BDS degree is not valid, but you get into the 3rd year of their DDS program.
Also, will you mention few healthcare companies which can recruit dental graduates as a fresher?
Fresh is IKS, Vasta Global. Starting pay is for Vasta Global is just 25K. For IKS, it is 35K as a medical writer or reviewer or data analyst. And Vasta is better than IKS. In IKS, the job is very tedious. Vasta is still better. You get a post of data analyst, medical data analyst. So that is a better position than a medical scribe. Medical scribe will be taken over by AI. There are a lot of layoffs happening now because of AI in the non-clinical healthcare sector, especially a medical scribe. So don't go into that. The jobs you might get easily, but don't go. You will waste your months and years in that job.
Okay.
Yes, your research projects, of course, will help you in your clinical and non-clinical journey. They will never ever go waste. Utilize your free time. Learn dentistry first if you are, inclined towards opening your practice, because in opening up your practice, research might help you get those decision-making skills. Should I put a formocresol dressing or not? Okay, let's read some article online. Okay, some articles say that formocresol dressing causes exacerbation of pulp and there can be more pain. Some suggest that you should do a good case selection for formocresol dressing. So that decision-making skills you get when you are a good researcher in your clinical practice. Non-clinical and of course research-related roles, you require research experience. So the earlier you start, the more better it will be. And utilize your free time in doing research papers. Your narrative and literature review doesn't require any on-patient experience or all those things, any permission. You can do it with the help of your college or without the help of your college as well. You need a mentor and guide.
But
We
if
have
you
a
do
research
with
program also to say. Yeah.
But if you do with the college, it's more beneficial and they will be guiding you throughout.
If you are the first author.
Yeah.
If you are the first author, then it is beneficial. If your professor or associate professor is the first author, then you will do all the work and
Yeah, that is the thing.
the article will be published in their name. So second author तक भी ठीक है, but third, fourth, fifth बनने का कुछ मतलब नहीं है. And so make sure, not necessary कि hospital का नाम होना चाहिए, college का नाम होना चाहिए. No, not at all. You can submit it individually in your clinic's name also. So we publish n number of research papers every month on the name of Goregaon Dental Center Research Program.
Yeah.
And, students are going foreign may and applying to universities. We are recommending them letters of recommendation and giving them experience letter as a research associate, etc. But it doesn't matter. In the end, your knowledge matters कि आपको कितना research के बारे में आता है. And you being the first or second author matters when you really need that research papers. Even one research paper will help you, but not having the research paper is like you are missing something. Something you are missing if you don't have even a single research paper in your name.
Okay.
Yeah.
So, as salary is very less as a dentist, what is other job options which pay high after BDS?
The highest is opening our own clinic. I know people who earn 50 lakhs to 1 crore in a month. Trust me, ये इतना पेमेंट कोई भी नहीं देगा तुमको. So that is the best option because the salary is very less. I had explained few things earlier कि
Yes.
देखो अगर आप किसी लोकम जॉब में जा रहे हो, if you are going to a locum job, and if that dentist has that kind of practice कि okay he has 10 patients waiting for him and you will be a help for him with your clinical skills and you will generate that kind of money from those 10 patients. You have that talent of speaking and doing the treatment. If you generate like 1 lakh rupees for him, you can definitely ask 30-40,000 of that share.
Yeah.
But अगर डेंटिस्ट के पास ही पेशेंट्स नहीं होंगे तो वो तुमको सैलरी कैसे देगा? तुम काम क्या करोगे, पैसे क्या कमाओगे? So it is not directly related to labor. I am working for 9 hours, so I should be paid like 18,000, 25,000, 30,000. It is based on the money that you can generate. First of all, I as an employer should have that kind of patients to give it to you. Only then I should hire you. And if I have those kinds of patients to give it to you, you should be talented enough to talk. First is talking, that is a skill. And second is doing the treatment. Third is managing those patients to generate money. Because we are talking about salary, we will talk about generation of money. If you can generate that amount of money, I am more than happy to make you like crorepati. But if you can't, then don't expect a salary. And of course, open up your own clinic. How much is the minimum amount you need to open a clinic in tier 2 city to open a decent practice in tier 1, tier 2, tier 3, any kind of place, a decent practice wherein you will practice ethically is 10 lakh rupees. 10 लाख तो तुम्हारे पास होने ही चाहिए. एक अच्छा स्टेरिलाइजेशन यूनिट, एक अच्छा आरवीजी, अच्छे इक्विपमेंट्स, रेंट भरने के लिए थोड़ा सा पैसा, मार्केटिंग करने के लिए थोड़ा सा पैसा, फिर 2-3 लाख में आ जाएगा एक अच्छा आरवीजी, एक 1.2 lakhs का.
Also, sir, is there any role such as dental UX designer or dental UX researcher?
Yes, there is. You need to do certain UX courses, but it is for a non-clinical profile, not a clinical profile.
Okay.
And you get selected into non-clinical companies who are hiring for that role. Go into LinkedIn, search for people who have already done that course and see where they are working, since how many years they are working. So start using LinkedIn instead of scrolling Instagram and social media. Now is the time for you to get to know things. Everything is there, information is already there online. You just need to search it smartly. So any kind of question that you have now related non-clinical degrees, you go on LinkedIn, search dentist and that non-clinical degree and look at people and their situation. You will get to know whether you want to do this job or not. Look as to from where they have done these courses. Of course, if someone has done an online MBA and got into a good role, go for it. But I would not personally recommend that. But if you see on LinkedIn someone doing that, go for it. But I know people on LinkedIn a lot. We have more than 15,000 followers on LinkedIn as well. So I am in connections with everyone from all the fields, and I've seen their growth and then advising you.
Okay, so there's one question. What parameters one should look into a clinic before applying for a GP there?
As a locum, you should see that he should have patients. Should look into a clinic. Okay. He or she should have patients over there for you to do. जाके सिर्फ दवाखाना खोल के बैठना नहीं है. Then he or she should have patients, walk-in patients, new patient, old patient for you and you should have those skills. as to अगर मैं बोली वो commit किया है मैंने तो फिर मुझे उतना आना चाहिए.
True.
What soft
And
skills would
also,
you
what
recommend
soft
apart
skills
from
would you
the hard
recommend?
skills one should
have
have
at
an
the-
edge on CV? Communication skills, OPD conversion skills. That is the only thing that matters. No attitude, no doctor's God syndrome should be developed. Uh, Empathetic, looking from the patient's aspect and their needs. Talkative, extroverted, introvert. If you are an introvert, you have to become extrovert in front of patients. And explain them why you want to do the treatment because it is betterment for them. If you deliver this message, they will be converted. Your OPD conversion rate will be high. And yeah, these are the soft skills that you should develop. Hard skills, तो तुम्हारा general dentistry है.
Hmm.
Any digital marketing skills, dental photography skills. So in today's time, if your clinic is not online, you really don't have a business. Because हर एक बूढ़ा बूढ़ी हर एक इंसान के पास मोबाइल फोन है.
Yeah.
अगर तुम उनको नहीं रीच कर पा रहे हो, that means you really don't have a business. Digital marketing is one of the community engaging activities that is required for a private dental practice to run. One of the community engaging activities, ताकि लोगों को पता चले कि तुम्हारा दवाखाना ये बिल्डिंग के नीचे है या ये जगह पे है. So yes, digital marketing skills you require, but not necessary. अगर by God's grace and by luck you get those patients. There are practices who don't do digital marketing and are running well. There are practices who do digital marketing but are not running.
Any opinion on AI?
For a general dental practice, I don't think so. Right now, you need to learn AI. In radiology, that is, they interpret the radiograph in OPG. That is beneficial for you, providing a proper written report of an OPG or a radiograph. You can send them instantly. But you have those EMR softwares, that is electronic medical record softwares that do the thing for you. You don't need to personally learn AI. Of course, for content creation, for digital marketing skills, you require to learn AI. At least ChatGPT you should know. We can move to the next question.
Yes. So, this question is personally for you. How do you make contacts and make your clinic grow?
So I opened my LinkedIn in 2016, and it took me like 8 years to connect to 10,000 plus
So,
connections. 8 years. So it is that slow. There is no going viral in that. So LinkedIn is where I found my contacts. Of course, my friends. जो मेरा फर्स्ट कंसल्टेंट था वो मेरा बैचमेट ही था, बीडीएस का बैचमेट जिसने एमडीएस किया था प्रोसेस में, डॉक्टर अबिद. And endo was Dr. Vinci, was rule number 21. I was rule number 28. So फ्रेंड्स ही काम आएंगे तुमको इनिशियल कॉन्टैक्ट्स बनाने में. वेंडर्स का यू नीड हेल्प. ऐसे ही नहीं कॉन्टैक्ट्स मिलते हैं. चेयर वेंडर, मटेरियल वेंडर, यू नीड टू बार्गेन, हैव गुड नेगोशिएशन स्किल्स. पैमडेंट होता है एंड अदर कॉन्फ्रेंसेस होते हैं, सो यू कैन गो देयर, टॉक टू पीपल एक्सेट्रा. But if professional contacts, it can happen through LinkedIn and through WhatsApp groups, through your seniors and juniors, etc. Now to clinic growth के लिए फिर वो सिर्फ डेंटिस्ट में तुमको फेमस होना है कि तुमको पेशेंट्स में फेमस होना है, वो डिसाइड कर लो एंड देन कॉन्टैक्ट्स बनाओ. जिसको पेशेंट्स में फेमस होना है वो एनजीओस के साथ कॉन्टैक्ट बनाता है, वो लोकल कम्युनिटी लीडर्स के साथ कॉन्टैक्ट बनाता है, पॉलिटिशियंस से कॉन्टैक्ट बनाता है, सोसाइटी के सेक्रेटरी से कॉन्टैक्ट बनाता है, सोसाइटी के वॉचमैन से कॉन्टैक्ट बनाता है, स्लम चॉल्स के जो अधिकारी है उनसे कॉन्टैक्ट बनाता है. सो क्लिनिक ग्रोथ इज ऑन पेशेंट्स, नॉट फ्रॉम डेंटिस्ट. सो मेन कॉन्टैक्ट्स यू शुड be getting is of the community wherein you are going to practice.
also, I think we missed on one question. Is MBA worth doing?
Yeah, it is worth. If you don't like dentistry, it is worth. But instead of an MBA, you can go ahead with a PGDM program. The college that I know is IHMR Bangalore. They have good placements. 2 years program, 8 lakh fees, like 7-8 lakh package you get. Many of my friends, juniors and seniors have done it from them. No exams required. no strings attached. एंड कोई एग्जाम क्रैक करने का जरूरत नहीं है, फर्स्ट कम फर्स्ट सर्व रहता है, ये मंथ्स में उनका एडमिशन प्रोसेस होता है. Instead of an MBA program, you can go ahead with that. That will help you in non-clinical. That is, it will open other streams of non-clinical also. अगर सिर्फ MBA करोगे तो सिर्फ बिजनेस एडमिनिस्ट्रेशन में रह जाओगे,
Yeah.
बाकी के MPH वगैरह के जॉब्स को नहीं अप्लाई कर पाओगे. बट इफ यू डू PGDM, ये दोनों एस्पेक्ट्स ओपन हो जाते हैं. And of course, you need to dedicate 2 years of your life. There are other non-clinical courses also, which I personally can recommend. So anyone can message Dr. Sakshi or me on the group, and I might share the information. So I think if anyone has any questions, we
Yeah.
have last 2 to 5 minutes with me, that I can answer them. Otherwise, it was a good session. 62 people out of 200 have joined.
If anybody has any more questions, they can post in the chat box.
We'll wait for a minute if there are no
Yeah,
questions,
sure.
and then we'll stop the meet. Anyone can raise their
Can
hands
we
and
have more
ask.
clinical sessions?
Yes, Dr. Gagan.
Can we have more clinical sessions from next onwards?
Clinical sessions as in endo, prostho, all those
Actually, sir,
things.
I'm doing PG in endo, so I want more clinical sessions in endo.
Yeah, no problem. वो तो website पे होता रहेगा, and Sakshi will organize those things. So I am not a person that you should ask endo of. I know access opening very well, but I love tooth preparations and extractions, surgical extractions and tooth preparations, etc. Dhwani Bhatia, yes, you can ask a question.
I want to know the scope of oral and maxillofacial surgery in India versus out of India, like UK.
So in India, it is a 3-year MDS program. In UK, it is a 10 years program.
Yeah.
So to actually practice oral and maxillofacial surgery, that kind of specialty, especially in UK, you require 10 years. That is 3 years of that MSc program, and then another 3 years of residency, junior residency, then senior resident, and then somewhere you get into an hospital and practice as a junior doctor. So in India, OMFS, if you are talented, OMFS is a very, very good field if you like surgeries and all those stuff.
What about
Ghule,
monetary? Sorry, what about monetary point of view?
Yeah, in India also. India also you can earn well. Outside India also you can earn well. The time that you dedicate in India is less. The time that you dedicate outside is pretty huge. That if you are passed out in 24, you will be earning very, very good amount of money when you are 35.
Sure.
But in India, you can earn that in 27, 28, 29 also. You can get associated with multiple hospitals and go for consults, do on-code, do other types of advanced surgeries also, other than dissection and simple and complicated extractions.
Thank you.
Yeah, welcome. Jill
Ghule
Vyas.
Vyas, you can unmute yourself.
Yeah, sir, I wanted to ask what is the scope of forensic dentistry and how do we get into it after BDS, if there's something?
So there are diploma programs, fellowship programs in forensic dentistry. One of my senior has joined Sion Hospital in Mumbai as a forensic odontologist, but she had good recommendations through that. Other than that, out of Mumbai, there are positions in hospital in the forensic department, but there is just one forensic odontologist, and most of the work is done by the other forensic surgeons. So
Okay, sir.
to apply to foreign universities, that is a good thing. But in India, the job opportunities are quite scarce and less.
Okay, sir. Thank you,
Yeah.
sir.
Ipshita, you can unmute yourself.
So I wanted to ask about the what in BDS after that defense. If anyone wants to join defense after BDS, so what are the scopes?
Army Dental Corps. My friend Pankaj Jiyal is there. based on the NEET marks and the number of openings of that year. That is, if there are 50 openings, they will call 200 people for interview. Those 200 will be those in the merit rank who are not selected in a MDS program, and if they have specifically applied for Army Dental Corps. It is a beautiful field, good amount of money. That is 1.5 lakh rupees they pay. Everything is given to you. First 3 years would be near the borders service. So that is a bit dangerous. And after those 3 years, if you have completed that service of the war postings that they call, you get peace postings in good parts of India. So it is a dangerous field. Those fields are most often taken by someone who is already of army background, but it doesn't depend on the interview. They take non-army background people as well. So it is an interview process of those 200 people. It is not a merit-based process of those 200 people that are selected. Selection is done on merit-based of those 200, and with that interview process, it is based on the one-on-one interviews that it happens. The medical test, you shouldn't have an eyewear, your hands shouldn't be
Okay.
sweaty. A lot of these things are there for Army Dental Corps.
Also, there's one question. So please recommend some good fellowship programs, private and government both.
So for general dentistry, program like CEP of GDC Goregaon is good. For biomimetic dentistry in Nerul is there. Neral Mathiran, where you can learn biomimetic dentistry. It is a very short course. Microdentistry, if you want to, MUHS fellowships are really good. Not from those institutes who don't provide patients. I won't name them, but don't do fellowships from those institutes that do not provide patients. See, 90% fellowship program में तुमको patient नहीं मिलने वाले हैं. तुमको सिर्फ theoretical knowledge ही मिलेगा, क्योंकि patient priority PGs को दिया जाता है.
Yes.
Shubharti and Savita Dental. Prosto fellowships are good. 2 years MSc they have in Prosto. Those I have heard they provide patients. So yeah.
Also, what is your opinion about pursuing dentistry abroad like Australia?
Yeah, it's good. Lonely, but good. It's good. Lot of investment, but good.
Also, someone wants to know from which college you did BDS.
I did from a private college, Bharati Vidyapith Sangli. Had good patient flow at that time. As I said, 100 में से 10 लोग ही काम करते थे, तो good patient flow हमारे लिए बहुत अच्छा हुआ. So yeah, I did my BDS from there.
Also, any more questions? Dhwani, you can unmute yourself.
More 5 minutes and then we'll close this meet. If you have any more questions, you can ask Dr. Sakshi or on the group, okay?
Can I know about the medical emergency specialist that you mentioned? How to work in
The
it?
EMS program is really good. It is of 11 months. 6 months online, 3 months in Bangalore, and 2 months of internship in a hospital is the provider. And they directly recruit you in your own city hospital. That is, they have more than 35 plus networks. And most probably one of the hospital in your city will be associated with them because they're the largest emergency medical service providers. The starting package is 6 lakh rupees, and later on, once your post increases, your package increases. But this is completely different than, dentistry. You get managerial roles, okay? You are not doing CPR over there, mind me. You get managerial roles over there.
Okay, just like an intern informing the patients and
Not
asking
like an
the
intern.
necessary
Absolutely not.
instructions to.
No, absolutely not. You handle the medical emergency department. We have posted a reel on Instagram, the recent reel that describes the job post that you get after EMS. There is a webinar on 5th. I might post the link of registration on the group. You can attend that webinar also, wherein Red Health is going to take that webinar.
Okay, and how about I have seen some courses that I've heard some courses that we can do online and just we can like add those names on your board if at all we are not MDS. So, do you know any of those like which are very like for less cost we can have that like some online programs?
Non-clinical online is worthless.
No, clinical things which we can showcase are like when we don't have MDS.
According to DCI rules, you can only put up your BDS and MDS degree on the wall of your clinic.
Okay,
Okay, that is the DCI rule,
okay,
because you cannot influence patient's decision based on other degrees that you have done, and it doesn't really signify that. But if that particular skill you feel that that institution is giving well and you can use that in your clinic and earn money out of it, it doesn't matter whether you put up that board. आधे से ज्यादा पेशेंट तो बोर्ड देखते नहीं है.
mm,
मुझे बहुत सारे क्लिनिक पता है उन्होंने डिग्री भी पुट अप नहीं की है.
mm.
तो जब तक कोई चेकिंग के लिए नहीं आता, जो पकड़ा गया वो चोर.
लेकिन
जो नहीं
पेशेंट
पकड़ा
के
गया
लिए
वो.
तो एमडीएस नहीं किया तो कुछ है, कुछ तो है, कुछ तो किया उन्होंने लाइक
Yeah,
यूज
you
करके.
can put
हाँ, इसमें
certain
ऐसा
pictures
ऐसा
of
कुछ है ऐसे.
your cases, and then right, legally, ethically, तुम तुम्हारे केसेस शोकेस कर सकते हो टीवी पे या कहीं और पे. बट एथिकली DCI only allows your MDS and BDS degree to be put up on the outside or inside your operatory of the clinic.
Okay,
Sir,
and
uh,
what?
I have seen in a lot of places they have put some diploma from Japan. I've seen many clinics. Do you know
See,
about that?
as I said, लिखने के लिए तो आप कोई भी abbreviations लिख सकते हो. It doesn't matter until unless you get into some medical legal case. It is you who are going to benefit from that course. It is you who are going to learn out of that course and do implants and veneers and all those things. So, but it shouldn't influence, ethically, it shouldn't influence any choice of the patient. Looking at your board, अरे ये कौन सा हाई-फाई जापान का डिग्री लिखा हुआ है, मैं ये डॉक्टर के पास जाता हूँ क्योंकि ये जापान से पढ़ के आई है. So that is influencing a patient's decision to choose a doctor. That is unethical. You need to read those ethical rules of DCI and State Council.
How to do research as a BDS practitioner, like Gure, your institute is doing? Like what
So we
are
provide a 45 days program wherein we teach you narrative research. You get a mentor who is MDS in public health dentistry,
okay.
whose main forte is doing research. And it is a 45 days program. There are sessions. You write your own article. We guide you on each and every word and line, and you make your own article. We publish it in a non-index journal, which is a low-level journal. And once you learn research, you can publish your own articles by yourself after those 45-50 days.
And what is the main advantage of publishing journals being a clinician, like rather than not going to any other country or somehow?
So for your private practice, it helps you make good decisions. Somewhere, God forbid, अगर कहीं पे लोकल जॉब के लिए अप्लाई करना पड़ा किसी दिन, या किसी हॉस्पिटल में अप्लाई करना पड़ा, या कोई वैकेंसी दिखी, तो रिसर्च CV में काम आता है. And for non-clinical jobs, of course, it is very useful. So
Oh,
specifically to run your practice, no, not required to spend that money. But I would hire someone who has, 5 to 6 years of associate dentist job with
and
me, because I know
and
इसका decision making skills अच्छा है, वो सोचता है, वो पढ़ता है.
how about medical coding or medical transcription?
Yeah. So basically, research is you are reading something, you are summarizing something, you are analyzing something, you are making decision out of it, and you summarize it, you write it, and then you publish it. So this is kind of a work X that you get. तो मेरे पास ये वर्क एक्सपीरियंस है एक रिसर्च पेपर का, उससे मैं मेडिकल कोडिंग अच्छे से ये जॉब के लिए अप्लाई कर सकता हूँ. तो नॉन क्लिनिकल CV में रिसर्च पेपर होना अच्छी बात है.
Also, there's one question. What are your opinion about IDA membership and courses that IDA provide?
So officially I cannot comment. So it is your decision that you want to take on any kind of fellowship. You can get in touch with me and I might recommend you the programs that I know that provide patients and wherein you actually get to other than just getting the degree.
Cosmetic dentistry, the question has been answered before.
So I think we should close it. You
Yeah.
can get in touch with me on the group.
Yeah.
संडे इवनिंग एंजॉय करो सब लोग. डेंटिस्ट्री में मंडे टू सैटरडे बहुत काम होता है. Okay.
Yeah, also, guys, you all can stay in the group. We will be posting about the webinars on that group itself and also on the Instagram channel. So, thank you
ठीक है,
everyone for
चलिए.
being a part of
Yes,
today's
Sakshi.
insightful webinar. A special
Thank
thank you to
you.
our incredible speaker, Dr. Naval Ghule, for taking the time to guide us through the often confusing and exciting world of dental career opportunities. Your journey, insights, and practical tips have truly inspired many young minds today. From clinical excellence to leadership in public health and mentoring future professionals, you have shown us what's possible beyond the classroom. And I think he's the man who has taken dentistry to the greatest heights today. To all the attendees, thank you for your enthusiastic participation, engaging questions, and for making the session so interactive. I hope each one of you is walking away with clarity, motivation, and a renewed sense of purpose in your dental journey. This is just the beginning. We encourage you to stay connected, keep exploring, and most importantly, never stop learning. On behalf of Goregaon Dental Center and RCMM, thank you once again. We look forward to seeing you in many more such impactful sessions. Thank you so much, sir, for your valuable time.
Thank you, Sakshi, for organizing this.
All right. Thank you.
Thank you. Thank you, everybody.